As we already know, during the arthroscopy procedure, the surgeon will put two small incisions on either side of the kneecap tendon. These incisions are used to introduce the instruments needed to perform the procedure. Once the procedure has been completed, those incisions are generally closed with 2 to 3 steri strips. Over the top of this, the surgeon will put 2 clear waterproof dressings, and the post-operative management will generally be to keep these waterproof dressings on until review date, which is usually between 10 to 14 days post-surgery. Some surgeons then will apply a crepe and cotton wool bandage, and this crepe and cotton wool bandage stays on for approximately 48 to 72 hours, at which point the direction will be to replace with the tubigrip bandage. So some patients will come back from theatre with a crepe and Velvan dressing. Usually post-operatively, the surgeon will ask that this bandage stays on for approximately 48 to 72 hours, at which point the patient can take this dressing off and replace it with a tubigrip. Some surgeons, however, prefer to have the tubigrip applied post-surgery, so you may see them come back onto the ward in day surge already with the tubigrip applied. The purpose of the tubigrip is to apply compression. Why is compression important? Because we want to try and minimise post-operative swelling. In many situations with arthroscopy surgery, you don't see a lot of swelling, but there are situations where during the procedure there may be more swelling than anticipated, and the tubigrip is a great way of minimising this swelling. Obviously, post-operatively, the directions will involve the patient taking things quietly, making sure they do have a period of rest, and to listen to the symptoms of their knee. We do educate them to try and keep their leg elevated where appropriate, and to minimise the amount of time they spend on their feet. Obviously, when they're standing, gravity will push fluid towards their knee. If they're able to sit down and elevate their knee, it's a great way of minimising this swelling. Icing is another procedure that we use to try and minimise swelling. This can be most effective when the patient's wearing tubigrip, as we direct them to take the tubigrip down, apply a wet bandage or a wet cloth onto the skin, between the skin and the ice pack, to minimise the risk of freezing the skin. If a patient's wearing crepe and Velvan post-surgery, it is a little bit more difficult to ice, but we still encourage patients to try to put a plastic bag between their ice pack and the Velvan dressing. Obviously, we're trying to keep that dressing dry. If the patient can feel the cold come through that dressing, then it's worthwhile continuing the icing process. If the patient struggles to feel the cold, then it's best to just rely on the icing process once they take that Velvan down, usually between 48 to 72 hours. Crutches are used to try and minimise the amount of pressure being taken through the knee post-surgery. In most arthroscopy surgeries, the direction is weight bearing is tolerated, in which case we encourage people to use the crutches until they can walk comfortably without a limp. And this can be anywhere between 48 to 72 hours, or it could be even longer, depending on the procedure performed. Just as a note, it's always worthwhile reading the post-operative notes in case there is some weight-bearing restriction placed on the patient. In this case, then the patient may use the crutches for a longer period of time or have a weight-bearing restriction, as I said, depending on the procedure that was performed. The physio will also come around and give some exercises. These exercises are fairly basic. We call them maintenance exercises. They're not designed to increase strength or increase movement. They're really designed just to maintain as much of the muscle tone and strength as the patient can in the early days post-surgery. Most of the strength gains can be achieved once the symptoms have resolved, that is pain and swelling, and that can then usually occur generally post-review with the surgeon.